A scar is nature's super glue. As much as we hate them, we should also love them. If we leave a big open wound alone, it could get infected and even kill us. But evolution gave us scars to shrink the hole until it's closed. On the other hand, everyone knows Scarface is a bad guy. Just look at him. But if you're a good guy, you might want to get that scar fixed. But with Botox? Welcome to Skin Tuition. I'm Heather Furness.
And I'm Josh Corman. From pimples to wrinkles, our skin affects how we feel about ourselves. As two plastic surgeons, we discuss what's new, what's safe, and what to look for when you're ready to hit refresh.
We talk about scars as something bad, like psychological scars.
Well, scars are bad, aren't they? Well, they kind of are bad. I think from little kids our whole careers, we have parents desperately worried about their children's injuries and make the scar disappear, make it like it never happened. But we don't really carry around erasers, but scars work at a lot of levels. They work at the very psychological level, and scars are also very visible. When I used to work in Scotland a long time ago, there was a very violent past in the city of Glasgow when there were things called the Glasgow kiss and the Glasgow smile. And the Glasgow kiss is when somebody did a very big headbutt to somebody else, causing an open wound. And a Glasgow smile was even worse, when a Stanley knife was used to cut the face across from ear to ear and even get to the deeper structures like the nerves. So it's wounds and injuries and scars, they all go hand in hand, but we don't want them to all look bad. So we're here to talk about what can we do.
Okay, Glasgow scar, that sounds horrible. So when we have a real scar, we usually want to get rid of it. So let's define a scar. Well, you have an injury, an open wound. And in order to heal it, you have these white blood cells floating in the bloodstream, and some of them turn into collagen-making cells. We call them fibroblasts. And the collagen then is laid down and slowly closes in the edges of the wound and closes until the wound is healed. And that's what a scar is, but it's immature.
So immature, does that mean, what does that really mean? Immature, it means it's young? Does that mean it's going to get worse? What does that mean?
Yeah, like acne and braces and all that. Yeah, it's, the collagen is like heaped up like straw, and so it's thick and it's raised, and to smooth out all that heaped up collagen, we need energy and oxygen is carried by red blood cells. So the red blood cells need to be carried in vessels. So our scars actually form little capillaries carrying that red blood, which is why they tend to be red until all that collagen is flat, and then it's mature, grown up.
So why is it when people have a scar, they want it gone like tomorrow?
Yeah, there is a certain impatience. They want that thin white line, and they think that something is going wrong if it's a little bit thick and if it's pink. Now, then there's hypertrophic scars.
But I think it's a little bit like people are used to getting a new car and driving it off a lot, like a dealership off the lot when the car is perfect, not the scar, the car is perfect. And yet then it gets dinged up over time. The body's the reverse. It gets dinged up at the beginning and then it heals and gets a lot better.
Exactly. And then sometimes, though, the scar goes in overdrive. And that's when we get what we call hypertrophic scars. So I kind of imagine like two pirate ships. And those grappling irons, the pirates would would throw an anchor-like thing with a rope to try and pull the two ships together. That's sort of what I imagine collagen is doing. It's trying to close that wound. And if you have a hypertrophic scar, it's on overdrive. It's just throwing tons of those ropes and it's getting thicker and thicker. And it's still immature and it's red for a long, long time.
I think it's about a balance. Like a lot of things in the body and a lot of things in life is about a balance. And you have the collagen being built up and the collagen being taken down. And if there's an imbalance, that's when you get scars that are worse. And I think one thing that's really important to understand and to define scars appropriately, because a word that's so popular, and people think, oh, a keloid. So a keloid is the ultimate in imbalance between too much being built up and too much taken down.
Yeah, a keloid is actually not that common in Europeans. It's like 1 in 1,000. Among Africans, it's like 5 to 10%. Asians, 1%. A lot of people come in saying, "I have a keloid," and they actually have a hypertrophic scar. So a keloid goes beyond the boundaries of the scar. So if this is your scar, the keloid goes out like that. So think of a mushroom, and the keloid's the head of the mushroom or stalk of cauliflower, and the keloid is that flower. And dealing with a keloid is a lot tougher than dealing with hypertrophic scars.
Yeah, with keloids, you think as doctors, as patients, just cut it out. But the problem is, if you cut out a keloid, it can come back worse. And you think, well, why is that? Well, again, because it's too much. There's an imbalance between what is built up. But I think one thing that is interesting is I remember hearing for a long time that certain ethnicities were more prone to uh, worse scarring. And one of the ethnic groups that I heard that from was about African Americans. But actually, in my experience, African Americans tend to make actually really good scars. And that some of the um, uh, pictures that are examples of scars in African Americans, or actually in Africans, are from scarification techniques that are used in certain tribes, and it's that is scars on purpose for decorative purposes. But I found that actually African Americans in general make really good scars, often even better than Europeans or Caucasians.
Yeah, I mean, there's this tendency, and Josh is absolutely right. I've seen African Americans with beautiful scars and very pale Caucasians with really thick scars. So when you hear color of skin, that's only one factor. Genetics plays a really strong role, independent of color of skin.
I think another big thing is where on the body it happens, because there's certain locations like shoulders and back and chest that really create generally worse scars than in other places. And I think a big part of that is tension.
Exactly. Yeah. Tension is when we, kind of will use the term horse together, try and get two edges of a wound together that actually don't want to be together. And so you sew them with suture and you can see the blanching of each suture. That is a wound being closed under tension. And the skin is pulling away as a scar is trying desperately to close. That all those cells are producing collagen, desperately trying to keep that skin from pulling apart. And so, in order to prevent thick scars, we want to fight tension, and we can do that with tape or gel sheets. And silicone gel has the advantage that it can reduce redness and itchiness and pain and thickness and even pigmentation.
And sometimes it makes sense to do it in phases. Like if you're cutting out a scar, to take out the middle of it and then wait a few months. The thing I try to understand is so many people, and I'm not sure where they get this from, they think that you can just laser it and it will magically go away no matter what kind of scar it is. Just laser it. And I sure that lasers work in different ways, which we can talk about in a second. But I don't know why people think that lasers are the magic wand for making scars go away.
Yeah, lasers, I mean, it really depends on the type of laser. Um, and for example, there are lasers that are ablative and there are lasers that are non-ablative. And the non-ablative lasers are like pulse dye and neodymium YAG and diode, but there's also fractional ablative erbium YAG and fractional
So that's a lot
ablative.
of foreign language that I don't understand, and I'm a plastic surgeon. So can we go back a little and talk about lasers? Laser is just an acronym actually for artificial light, and so I think there are the lasers that work like electronic sandpaper, and there are kinds that go right after certain kinds of cells that don't break the skin. I think that's what ablative means, like sandpaper, and non-ablative is going after certain cells, like certain wavelengths of light, like reds and browns, and that's how tattoo removals are done. That's how um, uh, scars are treated. I think what I find is that you have to, just like in everything in medicine, you have to diagnose before you treat. So I think you have to kind of classify scars. And what I try to do is, and try to explain to my patients, is that color, texture, thickness, and how high it is. So that means how much it's getting in the way. Because a scar that's flat and just a different color, you treat differently than if it's really raised and also has a color problem.
Yeah. So I'm going to back up a little bit. We talked about pigmentation, and when you have a scar and you go out in the sun, it can become sort of a blotchy brown, and we call that post-inflammatory pigmentation, which is not a great term because it's actually during the inflammatory period when the scar is building up that and being created that you see this kind of blotchy brown. So if you have an exposed scar, you want to wear sunscreen and or use protective clothing. And that goes for any type of scar, whether it's an acne scar or just a cut, road rash, or surgery. Um,
So
and
how long do you think this people need to put sunblock on after they have a scar?
Well, obviously, you always want to wear sunscreen for just protective reasons. But as far as the hyperpigmentation or the post-inflammatory pigmentation, I tell patients while it's pink, because that's when it's still inflamed, it's still building, it's still in its immature phase, and that's when it's most likely to become pigmented.
Yeah, I think people have all kinds of ideas about what's good for scars. Like some people think sun is good for scars. Some people think cold. Some people think pressure is good for scars. Well, pressure actually can be good for scars. And it helps stop this imbalance between buildup and takedown of scars. But sometimes it's hard to do pressure if it's in certain places on the skin. So, what about in certain times of life, like during pregnancy, because there's a lot of hormones going on, and that's when scars can thicken a lot. Um,
Yeah.
Also, in people with blood pressure issues, I mean, there are reasons why scars can be worse or better different times of life.
Yeah. So if you're pregnant and you have something that could be done at another time under local anesthesia. It's better to wait. And if you have high blood pressure and you're planning surgery, then get that blood pressure controlled, not just for your health, but also to promote better scarring. Now, to prevent scars, let's say you have a history of thick scars. We mentioned Botox.
So I think, Botox helps to soften lines. So I think like you have to figure out what does the scar actually look like. So I think one thing to understand is what kind of scar is it? Now, as for Scarface, like we talked about before, Botox probably would be maybe too late for him. Um, uh, if he had gotten stitched up right after the knife fight, well, just like after surgery, the Botox could help prevent a hypertrophic scar. In reality, that book and the movie of Scarface are based on Al Capone, whose nickname was Scarface. And Capone's scar would probably have needed a surgical scar revision. I think scars are, it's interesting how scars are a sign of ruggedness. In this world we live in today, people talk about different um, amounts of what's considered uh, for gender or for ethnicity, so many different things. And scars are, I think, part of the reason scars in the past were thought of oh, it's a sign of being tough. I think I don't think anyone really wants a scar. I think it's just that when it's hard to fix, you have to live with it, especially if it's in conspicuous places.
Yeah, Al Capone was actually reportedly insulting a woman, and that woman's brothers were right there. And it was one of the brothers that slashed his face from ear to corner of mouth. And it looks like he didn't get the best repair. And if you look, the direction is directly opposite our natural skin lines. And that's not so good.
Yeah, well, as we said before, that's half the glass. It's like he had the half the Glasgow smile. So it's it, it is except if it gets fixed in utero, which doesn't really work in practical terms because it doesn't really allow. It hasn't been successful in having babies reach term and to be born. It is important to understand that scars that penetrate below the very superficial layers of the skin they're permanent. And the idea is to try to make them as invisible as possible. And we all have marks. We all have, that's part of what life is. But it's important to understand what we can do to make them better. And as Heather, you just said, understanding skin lines and skin tension lines, it's the easiest way to understand that is if you look in the mirror and smile, you can see the natural creases of the face, and those are the natural skin tension lines. And scars that are lined up in the same direction as wrinkles and lines heal much better than scars that cross these lines or ones that are perpendicular to the lines. And scars that are more likely to need surgery are often ones that are perpendicular to the skin tension lines, but that's for another topic. So to get back to understanding about thickened scars, Heather, what are the options?
Okay, well, let's start from the least invasive. We'll talk about steroids, and the Japanese actually do a lot of treatment of thickened scars, and they have a tape that we don't make in the U.S. that is steroid embedded into a tape and plaster. And so when the scar is still early, they will put the tape on and have patients wear it round the clock for at least 3 months and sometimes longer. And in lieu of the tape, you can use steroid creams and ointments 4 times a day for at least 3 months.
Wow. Does that mean you go to Japan to order it?
Well, you can order it off Amazon. I don't know where else, but I've ordered it before for a patient, and it's a box of tape. Very cool.
Wow. So, I guess the next step is you can, and it's not really clear why steroids work. Steroids, they reduce inflammation and probably stabilize the imbalance of the collagen cells getting built up and torn down. But it is a little confusing, and people always think of steroids as being bad for you, good for you. I mean, our bodies are full of natural occurring steroids. We need them to live, and there are a lot of different kinds of steroids. But steroid injections are really a very popular option. What's interesting about and I don't know how you do it, Heather, but when I learned how to do them, everybody said put some numbing medicine in along with the steroid. And I think the numbing medicine burns more than the steroid does. So I usually don't mix it with numbing medicine. I just inject the little steroid medicine and it goes quickly. And I find that is less painful for patients. How about you?
I'll mix it half and half, and so if I have to go back, at least it's numb then, but it does sting, and you can inject too much, and if you inject too much, it atrophies tissue, and blood vessels can appear like little red roads, on a road map. And so it pays to be judicious, not overdo. Don't inject beyond the scar. But when well done, it works really well. And sometimes we can combine it with an anti-tumor medicine called 5-FU. That combination works. And some people use bleomycin, which is another anti-tumor medicine, and they say some people will say it's the best, even better than steroid and 5-FU, but we'll use steroid and 5-FU.
Yeah, I think combination treatments sometimes work particularly well. And I guess it depends. Try one thing and then try other things. But remember that genetics are ruling. They are the ruling class. So how the scars end up after surgeries or after injuries and how they respond to treatment is very much primarily a function of genetics. Obviously, we can't do anything about genetics, so we do our best at trying these other options. What we talked about lasers before. So, do you think that ablative or non-ablative work best for the raised scars?
For the really aggressive raised scars, the ablative isn't so great, and that's probably because you're asking the wound healing of that person to kick in, and we already know that wound healing tends to go on overdrive. And so in those patients, non-ablative lasers are going to be better. How about you, Josh?
Yeah, I think I sort of try it again. It depends what's the diagnosis. Are they flat but red? Then I'd use non-ablative. If they're there's very ropey type scars, I actually think as long as they're not keloids, as long as they're hypertrophic, I think excising them can be really good. And sometimes I'll follow that up with an injection of a steroid 3 weeks later. I want it to heal, but at the same time, not get into a vicious spiral with the buildup and the breakdown and end up with another scar that's as bad as the first one.
Yeah, there is a limit to what we can do non-surgically, and just as Josh said, if you have a really ropey scar, then just cut it out, add steroids, and you can apply pressure. Interestingly, studies have shown that massage is fine with normal, immature scars. But if somebody really has thick scars, you're adding tension when you're massaging. Pressure is okay, but in massage, you're actually moving the tissues away, and you can pull that scar and create tension.
So we've been talking a lot about scars in general, but let's shift a little bit to an affliction that many, many humans suffer from, and those are acne scars.
Yeah. We often minimize the impact of acne scars because it's so common. 80% of teens get acne, and a lot of adults have acne as well. But acne scars can be devastating for people because it's right there, it's your face, and the scars can be hypertrophic or they can be atrophic, meaning from atrophy. So, as Josh said, the scars can be very flat. They can be pink, but they can be very flat, and they can be indented so that the scarring can actually impact the fat underneath.
And it's also, I mean, we all learn and teach that you're not supposed to pop your pimples too much because that can make a pore and bigger hole. But there is more aggressive kind of acne called cystic acne that even if people don't touch it at all, it can really uh, cause a lot of injury to the skin and the surrounding area. And then as we age, those acne stars can go from little pits to being more obvious because as the skin loosens and the elastin loosens, and um, I think those are they do have big psychological impacts on patients and at any age, but obviously teenagers are very self conscious, and in our world of TikTok and social media where everybody puts the filter on, so it makes it look like they're just don't have a wrinkle or a pimple on their face. It can be really very psychologically painful, um, and I think there are things that you can do for acne scars, and I think we can talk about them a little bit because it's important to make sure people understand that there are options.
First, control the acne because you don't want to have these treatments while you've got actually infections with abscesses or cysts, pimples, pustules, that type of thing. So you need to control the acne. And so when you're dealing just with the scars rather than active acne, what would you do, Josh?
So I think it's a question of what is, again, the diagnosis. Do people have little holes? Do they have little pits that you can add little bits of filler to bring up the valleys from the hills and the valleys? Um, I found that it depends again on the type of skin. On lighter skin patients, I think there's certain uh, lasers actually that are fractional lasers that can um, go deeper, but with little skin bridges.
So, Josh,
And these,
what's a fractional laser?
so a fractional is like a half, a quarter, three eighths. No, that's a fraction. A fractional a fractional laser is designed that instead of having uh, just electric sandpaper going all the way down, uh, the there are these little uh, cores, little pinpoint cores of that the laser goes deeper but leaves micro skin bridges. So think of these boring needles that can go pretty deep, but because they're so close to each other, they preserve these little bridges of skin between, and that instead of causing a lot of damage, actually heal quite well. And there's a variety of this technology. There's fractional lasers, there's microneedling, there's coring, there's lots of technologies, but the idea is to be able to go deep enough, but to preserve the skin in between so that the healing is quick and reliable.
Yeah, as Josh said, you've got normal skin. If you have, like I mentioned at the very beginning, a big open wound, so you've got no skin, and the skin contracts and eventually closes the hole. But if you have just different pores, you've got skin all around those little tiny pores, so you can heal quickly, and it really reduces the risks of loss of pigmentation or scarring, that type of thing that can happen more frequently with a completely ablative laser. And then the microneedling RF. So RF is radio frequency. So the microneedling, you've got little tiny needles just barely getting into the skin. They're very short needles, and then they're insulated, and you've got radio frequency, which is a long wave, longer than laser, long wave energy, and it heats up the deeper tissues, deeper skin. And that can be effective in treating acne scars. And some people, though, with darker skin do better without any type of heat, no laser, no radio frequency. So microneedling is helpful for those patients. Plus, in some instances, some studies have shown that microneedling with PRP is really helpful. So what's PRP?
So, yes. So, Heather, you fractionated fraction. What is PRP?
You want to answer?
Yeah. So PRP stands for platelet-rich plasma. And basically, the way it works is you take a little tube of blood and you spin it in a centrifuge. And that separates the red blood cells from everything else. And the everything else is plasma. And plasma, platelet-rich plasma. So in the plasma are the platelets. And if you spin the blood, the red blood cells are the dark red that we all think of blood. And the lighter color is the plasma that has the platelet-rich plasma. And it's used for so many things.
So it's a liquid part of blood with these goodies floating within it.
Right. And it's used for many, many things. It's used in orthopedics, for joint injuries, joint problems, a wide variety of, it's almost for anything that ails you. PRP is helpful. It's used to inject in the scalp to help thicken hair. So it's used for many things. But in combination with the microneedling, the little needles open the pores so that the PRP with all their goodies can be injected deeper and help the skin recover. So PRP with microneedling can really help, especially with darker skin patients that won't tolerate some of the ablative lasers. You can help the acne quite a bit.
Yeah. So if you do have significant acne scars and you want your scars to be treated, I would not expect perfection. Your skin can look better, but if you really have, irregular skin, pitting and whatnot, there will be a limit. Now, these machines, the lasers, the radio frequency, microneedling, PRP, can really help improve the depressed scars. But then, as Josh mentioned, you may need filler after that to kind of help even out. It'll never be perfect, but that combination of the shrinking all those little scars, filling them in, can be boosted with a filler.
So there are so many treatments for scars, and that's mostly because there is no perfect and there is no perfection. But there's a lot of different treatments and new treatments coming all the time, and it's important to have hope. And obviously, the best thing is to prevent the scar. Al Capone would have been better not to insult the woman at the bar. He probably would have not been Scarface that way. But life happens, and then once you have a scar to deal with, there's a lot of ways to treat them.
Yeah, as Josh said, once you have a scar all the way through the skin, nothing's going to make it go away. The scar is a scar, but there's a lot we can do to help. Thank you for listening to Skin Tuition. I'm Heather Furness.
And I'm Josh Corman. See you next time.